As a pain medicine consultant, I think that the focus of the initial consultation is an explanation of what we actually understand by the term fibromyalgia. The term is associated with a lot of misunderstanding. A search of the internet reveals that some people even think it's a made-up condition. However, I know it's a real pain condition and the effects are real in every sense. One problem is that we do not fully understand why certain people get fibromyalgia, which makes it difficult to fully explain. We know that it is common, particularly in females around the ages of 20 to 60. We know that it causes pain in various parts of the body, resulting in poor sleep, poor concentration and poor memory. Typically, an area feels sore, but when we look at it, it's not swollen, red or hot. In fact, the pain feels like it's on the inside of the body. A common explanation is that the pain nerves that are present throughout the body are injured in some way and have become very sensitive to pain. That's why it feels painful if someone gently squeezes a muscle. There's no known cure for fibromyalgia, and by the time you come to see a pain consultant, most people know this, but it's still an important concept to talk through. There's no injection or surgery that can cure this condition. Medications can help, but come with their unwelcome side effects, such as sleepiness, which isn't great as fibromyalgia can result in feeling sleepy during the day. Morphine-like drugs are not recommended for the management of fibromyalgia. Therefore, the mainstay of pain management rests with the pain team, our consultants, physiotherapists and psychologists, and most importantly with what you, as a patient, can do to help manage this condition.
Fibromyalgia is characterised by pain in multiple and various parts of the body, and this can make the idea of movement and exercise feel impossible. Coupled with this is the lack of quality sleep. Patients sometimes feel too tired to even try. As a physiotherapist, we will need to strip everything back to basics to ensure that the exercise plan we have put in place is effective and achievable. Doing a huge amount on one day, followed by a few days of bed rest, is called boom and bust and is not a way to improve your fitness and flexibility. I would rather we did a little bit every day. With fibromyalgia, the muscles are in a sensitive state, and so it's best to use simple movements to improve their strength and flexibility, which will hopefully reduce their sensitivity. It's also a fact that movement and exercise releases endorphins, the body's own painkiller hormones, which can help. Exercise also improves sleep, which we know is effective with fibromyalgia, and so getting into a routine can really help with several different aspects to make this condition more manageable.
It's important to consider the mental health aspects of fibromyalgia. You are not just dealing with the incessant widespread pain that can make it difficult to focus on anything else, but also for many, it's the lack of sleep and energy, and that can be burdensome and also add to the fogginess in memory, attention and thought process. Managing life in the presence of pain and fatigue can be extremely challenging, and areas of enjoyment can become unenjoyable because of the presence of pain, or become less frequent as the focus is on trying to get through the day and meet the basic needs of self and others. Because of the physical and emotional challenges, social isolation can become more prominent, and sometimes there is anger too. A diagnosis can take many years to confirm, and you may have been left feeling at times that people think it is all in your head or imagination. But we know that fibromyalgia is a real pain condition that affects thousands of people in this country every year. A psychologist will explore the impacts of fibromyalgia on the various aspects of your life with you and how it has affected you as a person. The management of flare-ups of pain can also be difficult, particularly if you have already tried painkillers. Something else we can discuss in greater detail to help you manage these distressing instances. Overall, the role of a psychologist is to help you understand how fibromyalgia and its related problems are affecting various aspects of your life and how different tools may help. The focus is often on understanding why there is a link between our experience of pain and our emotions and how we can improve both. There is no quick fix and it will take time, but we are here to support you on that journey.
I think I had fibromyalgia for about 10 years before it was actually diagnosed. I kept having blood tests and scans, but they all came back negative. It was really frustrating at the time and made me feel like the doctors thought I was making it up. If you Google fibromyalgia, you may see that some people still think it's a mental health condition. However, now I realise it's very much a real condition, and the pain doctors confirm this. I get pain in most parts of my body through the week, as well as random areas feeling a bit numb for a few weeks, which then go back to normal. It's difficult to explain. Apart from the pain, the worst bit is the tiredness due to lack of sleep. I'd maybe get 3-4 hours at most a night, which made it difficult to do any exercises. When I did exercise, I was in bed for 2 days afterwards. I was in so much pain. I worked with the physiotherapist to come up with some stretches I could manage to do every day, even when the pain was bad. This did help. I then started walking for 15 minutes every morning, which also helps. The exercise and a bit of the fresh air improves my sleep. It's still not great, but it's better the more exercise I do. I think it's important to accept there is no cure to fibro. You have to learn to live with it. But you need to be shown how to do this, and the physiotherapist and the psychologist can help. But ultimately, it's down to me. It's not an overnight thing, so I have to be patient and keep moving forward.